Okay, good day, class. I'm happy to be with you today again. I'm your uncle, Suleiman Taji Usman, taking you on the disaster and emergency nursing, GNS 315. My pleasure having all of you on board. Hope you are all fine and hope you are getting used to your books. So, wish you all the best of luck. Today, we are going to continue on disaster and emergency. What are we going to discuss on disaster and emergency? We are going to discuss on general impact of disaster and emergency. What are the general impact of disasters and emergency? We are going to discuss on number one, loss of life. In every disaster or emergency, accurately, we used to record increased number of loss of life and properties. Number two is injury. A lot of people, maybe due to explosion, the sustained gravity of injury, depend on the level at which the injury gets to. We have series of people that will sustain injury in the disaster or emergency situation. Number three is element and co-system disruption, and environmental and co-system disruption. The environment will be destroyed to the extent that the marketing system will be disrupted, the schools, the toileting, water facilities, mention them. Host of others will be among those destroyed in the course of disaster and emergency. Number four is damage to housings and infrastructures. Like I mentioned, many houses will be destroyed, that many people will be homeless, looking for where to hide their heads, and no source of water supply, no source of power supply. All this serves as the impact of disaster. Number five is social and economic loss, as well as disruption of businesses. Nobody will be able to go to school. Nobody will be able to go to market. There will be no transactions of businesses. Everything stands still. No money in circulation. Inflation arises, and all sorts of things, and many things that people are being hoarded at that time. We have no place to be displaced for marketing. Then we have shortage of food, which is correct. In shortage of food, because there's no marketing, you only have some people, some group of few individuals only hoard their foods, and mostly some that hoarded the food has been destroyed due to disaster. Most of them are dead. Those that are eligible to come and sell those foods are dead or maimed, or having kind of impact in the course of the disaster, leading to food shortage, water shortage, and most of the hospitals and medical supplies are disrupted. The hospitals are bound, the means of ambulances are destroyed, and most of the staff in the medical centers are affected, either being maimed or being killed in the course of the disaster. Then there will be outbreak of the outbreak of communication disease, of communicable disease. The outbreak of communicable diseases like malaria, like cholera, like a host of others that will lead to outbreak because of lead to lack of sanitation. Everywhere is polluted, so it is liable that many people of the citizens of that area are infected with communicable diseases, and as far as they are, there's no means of ventilation. Then they start contacting the disease individually according to the number of them in the room or gathered together. They start contacting the outbreak of communicable diseases, mostly cholera, because of due to lack of poor water supply, and at times due to lack of social devices. You see a lot of people that is a lot of things that are happening within the lack of within the vicinity at which they created an apartment for them. Social devices happening, so may even lead them to most of them having even HIV. So we have lots of cultural heritage. Cultural heritage, uh, you see, whatever you have as your cultural heritage in your heritage center, in your gallery area, due to this war, due to the impact of disaster, due to the impact of the incident of what happened, most of this cultural heritage are destroyed. Then we have psychological problem such as post traumatic stress. We have psychological stress problem, thinking, thinking or a family thinking of how to feed the family, no means, no food, no money to even buy the food, no access to even go to the market to even buy the food. So creating a lot of psychological trauma, and many people are sleepless, and because of that, that creates a lot of problem to them, like hypertension, stroke, and a host of others will be affected due to in general impact of disaster. We have migration and distribution of lifestyle. Migration, many people start moving from one place to another to congest and that place, and the area at which the disaster happened may be left vacant and nobody is there, and they have to rush to an urban area or to another area as to lead to congestion of that environment. Then another one is sexual violence. In sexual violence, because of the temporary shelter they have created for them, boy and girls are mixed together, man and woman are mixed together, married or married. So a lot of assault to be happening, sexual violence, exploitation. We have sexual harassment. This is as a result of separation of women from their families and weakened structure. So a lot of things will be happening there, where you see a lot of rape cases are reported on daily basis. You see HIV ravaging the environment, sexual transmitted diseases due to uh, the general impact of that disaster that has happened to them. Then the last one will be human right violation, such as torture. We have battery. We have assault that will be happening in that environment, because people that are gathered there, they may not be of the same culture. Even though they are of the same culture, they are not of the same family. Some are patient, some are not patient. There are a lot of embarrassment on daily basis, because that place is not even their original home. It is being created for them to have shelter. So a lot of things will be happening, and impact of that will lead to a lot of sexual and trafficking. We have denial of basic needs. We have said that before. Denial of basic need, like schools, water supply, NEPA. We have no light, and interaction made free, fundamental human right for you to be able to move from one place to the other, because of that impact of that war, impact of that disaster, impact of that emergency that has happened will restrict movement of people and property from one place to the other. So if we can see all this as an impact, then what are the golden principles that we need to observe in the course of managing this kind of impact? We have highlighted it before. We need to re-echo on it. There are some golden principles. One, the golden principles are truly divided into two. We have the pre-hospital management. We have hospital management. In the pre-hospital management, we need to talk of one, the safety of environment. When you get to an area you need to rescue, first think of is safety. Safety of you, safety of the people around there, safety of those that you are rescuing. You have to ensure their safety. Then assessment. The area should be accessible. You have to create need at which that area could be accessed, so that you could be able to rescue people, unlike area that has no access road, no means of getting to the scene of the environment. So it will be difficult for you to rescue people at a time at which they need your uh, attention. So before you get access to that area, a lot of havoc has been done, and a lot of casualty will be recorded. Then another one is to carry out the primary assessment. How do you carry out the primary assessment? Let us use the rules of ABCD, and we have to identify life-threatening condition by sorting them out. You have to identify those that are having life-threatening conditions to attend to the patient based on their triage category. You have to make sure that you separate these people. Those people that are calling for urgent attention, bleeding, respiratory distress, and the other thing that is known can easily claim life, you attend to them first before any other thing. We have discussed about the triage itself, the color that will indicate about triage. We have briefly discussed about it, but we are still going to highlight it in future. Then let us talk of airway management. In the course of that area, those people that are having airway problem, then the clearance of their airways should be ensured. If possible, you do mouth-to-mouth respiration for those people that are gasping for air. That is pre-hospital care. Then we have to ensure that those people, the pharyngeal and nasopharyngeal airways are kept, if available, in the ambulance, and if not available in the ambulance, those kind of people are quickly rushed to hospital where they can get attention. Then let us look how the next number is hemorrhagic control. You have to control significant external hemorrhage, preserve in controlling the hemorrhage. You have to ensure that you apply tourniquet. You apply tourniquet above the area that is bleeding. When you apply tourniquet above the area that is bleeding, you ensure that it is firm, that is not letting blood out again. But you have to take cognizance of the time at which that tourniquet is being applied. After about 20-30 minutes, you release for blood supply to come, then you reapply again. You don't just tie. When you tie for too long a time, maybe transporting the patient from for a very far to a very far area, you allow the tourniquet to stay in situ for a very long time. Before you get down there, then the blood supply of that area, but I mean, you have cut it off for several hours. And if you cut blood supply off from an area, a limb, upper limb or lower limb, for several hours, two things are likely to happen. One, the area might have gone gangrene or dead due to lack of blood supply to that area for a very long time before you get to the area, or the blood you have that are stagnant up the above level of the tourniquet will now become a clotted material. By the time you now release your tourniquet, then the clotted material will now go and block the heart, and the patient will certainly die. There's no remedy to that, because the blood that has stagnant above the tourniquet has diminished in oxygen, and significant part of that blood is clotted. For the fact that significant part of that blood is clotted, if you now release after several hours, the patient is likely to die instantly of embolism, because of the impact of that blood that has become stagnant for several hours. It has lost concentration of oxygen. Hence, the patient may die. So, for safety, you have to ensure that the area that is being tourniquet is being applied from the scene of the accident. You have to lose the tourniquet after some time. After about 15, 20, 30 minutes, you have to release. When you lose, you retire back again. When you lose and retire back again, then it will refreshing back the blood accumulation above the tourniquet level to prevent blood clotting and loss of oxygen in that area. The next one is ventilation. Ensure that the area at which disaster has happened, after rescuing those people that are involved, ensure you provide ventilation for yourself to prevent suffocation. At times, when the area is not adequately ventilated, those people that are choked may likely die of suffocation. So ensure you adequately provide ventilation in that area. If some of them are having respiratory distress and you're having ambulance, stationary ambulance around, you take the patient to the ambulance and ensure you serve what is it called, oxygen in a concentrated form, so that before you now transport that patient to the hospital. Then, in the course of transporting the patient to hospital with the ambulance, ensure you give fluid. Ensure you give fluid. You hang your fluid. You serve your fluid, because the patient might be stabbed, to ensure that the energy is not adequately is starved to the body or to the brain, that may affect the brain. Then, if then next number is immobilization. If there's, in the course of you managing the patient, the course of disaster management, the patient has, some of them has a fracture. There's what we call immobilization. That mobilization is for you to ensure that the proper thing is being done, not to create more injury. There are some fracture that you may see there, they are not displaced. But in the course of you rescuing that patient, you now displace the fracture. You are creating more problem to the patient. And the other one is, if the patient is having like spinal injury, you have to ensure you get more hands to lift the patient professionally out of the scene, not to worsen the situation of the patient by having paralysis of the lower limb or paralysis of the upper limb may occur if the patient is not adequately being lifted in the professional way. So you have to ensure that you get more hands. So, and that number is control of what is it called, hypothermia, in case the patient is cold and is chill. So you have to ensure that you cover the patient up. When you cover the patient up with something like blanket to cover, to prevent the chilling of the patient, and it will reduce form of hypothermia. And then the second to the last one is transportation. You have to transport the patient. All those people that are affected, primarily affected, or those people that are their condition in the course of triage, those people that are highly affected are transported first to the hospital using transportation, especially the ambulance, because the ambulance services, in the course of you rescuing them, you have to call the services of the ambulance to come round and take them to where they are going to receive secondary management. Then all you have done as a nurse, ensure that you ensure that you document all you have done. Documentation and report. Ensure proper documentation, assessment, finding, intervention, care rendered to the patient. This assessment and intervention should be thoroughly and accurately communicated to the receiving hospital. Then all you have done for this patient in the scene of accident should be adequately reported. When you take the patient to the hospital, in the course of you handing over the patient to the hospital staff, you make sure that you adequately report the information to the person that is taking over from you. So those are the major thing you need to do in the course of pre-hospital management. You know, in the hospital management, when you come to the hospital, you now start to talk of admission, taking of vital signs. After taking of vital signs, you ensure the patient airway is clear. The patient is unconscious. You have to make sure you position the patient well. You have to make sure that you provide adequate ventilation for the patient. If the patient if the patient is hot, you have to make sure you provide adequate ventilation. If the patient respiratory tract and respiratory system or tract is being blocked, you have to make sure you apply the principle of ABC: A for airways, B for breathing, C for cardio management. You ensure that the heart is functioning well. You ensure, if the heart is not functioning well, you know that you need to use defibrillator. Defibrillator is just a machine used that can discharge current into the heart of the patient to stimulate the heart from functioning again. Then the breathing, ensure that you lose all the tightening clothes around the patient. You make sure that you lose you ensure that the belt, the other materials are relieved, and make sure you provide adequate ventilation for the patient to help to help the breathing system. Then the airways, that if the airway is blocked, make sure you use suction machine to clear all the airways. Ensure that you test the patient to respond. If the patient is responding, you pinch the patient. If the patient is responding, that is, if the patient is not talking, if the patient is unconscious, make sure you test the gravity of response of the patient by pinching the patient. Then pinching the patient still has level. It has level A, that is little pinching, the patient respond. It has level B, you have to pinch hard before the patient respond. Then pinching C, that is, we have to hold the patient tight on pinching before the patient can respond. So without that, whatever response that patient is giving, you have to make sure you document all this so that they know the patient is conscious, or unconscious, and the patient is responding to stimuli. It depends on the type of stimuli. Even the stimuli, when you talk to the patient, Amina, say you still respond. The patient, Amina is responding. But when you call Amina is not responding, that's when you need to pinch the patient. Then you have to, in the course of that again, you ensure that you serve all the necessary medication, either through fluid or and kind of fluid, correct kind of fluid that needed to be in situ, whatever injection that you need to put on in place. You have to relieve the patient pain and fear and anxiety, and you have to take the intake and output chart. You have to ensure whatever that is coming out from the patient, or whatever that is going into the patient, is the intake, the fluid the patient is consuming. In the case the patient is being have to take a liquid, whatever amount of liquid that the patient is taking, you have to measure it. Then look at the perspiration of the patient, whatever, all the urine bag of the patient, whatever that his patient is perspiring or the patient is bringing out from the urine bag, is the output. Then if the patient is waking up, you have to make sure you reassure the patient relatives. You have to make sure that the patient is comfortable. Make sure if the patient is having wound, you dress the wound with sterile material to prevent infection. Make sure that the patient is in a very much comfortable environment. Those are the things you just need to do in case of the patient is coming in now on admission. Make sure you keep monitoring the vital signs of the patient. Document anything you have seen that is you have done. Anything, not what you have seen, but what you have done for the patient. Make sure you document everything together so that you have good document of what the patient has received from you. Then let us look at the classification of disaster at being based on the level of disaster itself. One, we have minor disaster. In minor disaster, multiple patients are involved. Two, we have moderate disaster, multiple casualties are involved. So if you see the minor disaster, we say multiple patients are involved. They are involved, but the degree of their injury is not as severe as that of moderate. In the course of minor disaster, you say this involve about 25 or less than 25 people, and at least to require hospital treatment, and it is more common. This minor disaster is more common. But let us look at moderate disaster. Moderate disaster, this is multiple casualty incident. There could be up to 100 and at least 50 people will require hospital treatment in the case of moderate disaster. Then causes of problem for hospital in a state of emergency services, even though the management does not overwhelm the existing facility. When you come to moderate disaster, the people that are involved in this aspect are not overwhelming a facility that is more standard, because they may be less than 50 or less than 100. At this time, the people that are there can be handled in any hospital that is more of tertiary or is more of secondary, so than primary. Then it is less common and occurs in air, like aeroplane. Mostly the disaster from aeroplane are either moderate or severe. Then we have train accident, we have bus accident, we have flood, we have tornadoes, we have series of others. Then another one is major disaster. This major disaster, we should record mass casualty incident. In mass casualty incident, there are over 100 casualties at a time. 100, over 100. people getting involved at a time, then overwhelming it, this will overwhelm the existing health facilities. When you take all this number to one facility at a time, they overwhelm all the facilities, because the number of people that are involved in this problem, they are always high in number, and they can overwhelm the facilities. But this is less common. The causes the causes the greater amount of death. All this kind of major disaster causes great amount of death, great amount of injury, great amount of property damages. It occur majorly in earthquake, structural defect, and fire disaster. So most of all these things are things that when it occur, it claims many lives. So I think with this, we'll be able to say we have to stop at this point, so that I'll be able to go through all those aspects we have treated so far. By next week, we are going to start discussing on other classification of casualties. We'll ensure you that whatever question you have, you raise them, you send it to us, we will to before your exam. If you have time for revision, we provide means of revising. I still encourage you, to those of you who have not paid your school fees, please pay your school fees. Your coordinator has been alarming on that. For those of you that up to now that have not come online, we still need to please belt up, so that I'll be able to meet up with your educational standard. I wish you all the best of luck as we continue on this lecture period. Have a nice day.